Welcome back to the Fit Minute Podcast, Fitness for Real People, with your host, Gabrielle Mazar. On today's show, Gabrielle interviews Reza Amin, PhD, founder and CEO of Bastion Health, the first ever comprehensive app-based telehealth program for men's health. Bastion aims to normalize the conversation surrounding men's prostate and reproductive health and offers a way for men to proactively take control of their health from the comfort of their own home. They discuss how common men's health issues are and how you can get help from the comfort of your home. And now here's your host, personal trainer and stretch therapist, Gabrielle Mazar.
Welcome back to the Fit Minute Podcast, Fitness for Real People. I'm your host, Gabby Mazar. And on today's episode, I have Reza Amin, the CEO of Bastion Health. Bastion Health is a comprehensive app-based telehealth platform for men's health, focusing on two areas, reproductive health and prostate health. So welcome to the show today, Reza.
Thank you so much, Gabby. Thank you for having me.
Yeah. So this is a pretty interesting topic because I think men in general don't like to talk about these two specific things. I think a lot of ego is involved, a lot of embarrassment is involved in these two things. So getting help in this area is really, really important because prostate cancer is prevalent, and reproductive health in men is also something that does happen that we just don't discuss. So tell me a little bit about how Bastion Health came about and how you got started in reproductive and prostate health to begin with.
Sure. Thank you so much. It's a great question, actually. And as you know, when it comes to men's health and when it comes to men's health and anything on their belt, there's a stigma around it. And definitely we need to have these conversations to destigmatize the whole topic. A little bit about my background: I did my PhD in medical devices and health technologies. And my main research was on creating more convenient at-home diagnostic and healthcare solutions. But when me and my wife were trying to get pregnant, and we were in our fertility journey and trying to get pregnant, we quickly realized that there was no male reproductive health technology solution available to guide me through essential preparation for fatherhood. My difficulty with finding accessible solution on male reproductive health educational contents, basically, it was symptomatic of something much larger, and that was the problem that men's healthcare as a whole is underserved segment of men's health, or segment of healthcare. So therefore, as a researcher in healthcare, I started sort of focusing on men's healthcare, and we founded Bastion with a focus on men's health, so that we can help men getting more proactive during their journey.
Yeah, so as you said, there is a big stigma, and I think there are a lot of men and women, a lot of couples that do have issues having children, and it goes both ways. And as you said, how do you find someone to help you in that process? I mean, there's IVF, there's stuff to help women with their eggs, but there isn't a whole lot of talk about men and, you know, how much semen do you have? Are you producing? Can you even, I have heard many stories about my friends personally who have had issues getting pregnant, and it's not always one-sided or both-sided. And the information out there can be very, very overwhelming. So it's hard to find that niche, find that what you're looking for to help you and guide you in that area. So tell us, what exactly is Bastion Health? You founded this to reach men. What is it, and how does it help men, guide them in this process?
So at Bastion Health, we are the first at-home specialty telehealth focused on men's reproductive health and prostate health. So men in the comfort of their home, they can start conversation with men's reproductive health and men's prostate health specialists, get the initial assessment, get the educational they need, and educational content they need. We have curated contents in collaboration with Harvard Health and Mayo Clinic that men could go there, read those contents, and get informed about their health, be more proactive, and be engaged into improving their health.
Okay. So with the app, with all of that, if they reach out to you, what is the process behind that? What exactly are they doing? What exactly are they looking for? What do you do with the whole process through that?
Yeah, so let's focus on men's reproductive health assessment. If someone is interested to get our application or get our assessment plan, they just need to go to www.getbastion.com and then download our mobile phone application or schedule a free consult with one of our care coordinators. The next step is to get the plan, and then they can schedule their first visit. Usually during the first visit, they're going to get some educational content, they're going to get initial conversation with their care team, and then from there, they're going to send them to their closest laboratory to do the lab testings required. And the next conversation they're going to have would be another conversation with a urologist who's going to sit down with them and talk about all the details about their health and design a treatment plan, which would be the next step if in case they need a treatment. And many times they just need to improve their lifestyle. So we help them to learn more about their how to improve their lifestyle so that they can have a better chance of getting pregnant.
Through diet, exercise,
exactly,
those types of things. Maybe they have diabetes or cardiovascular disease, something that's preventing them from being able to reproduce.
Exactly.
Yeah. So let's talk about prostate health for a second. You said that 1 in 8 men will be diagnosed with prostate cancer at some point in their life. That's a pretty high statistic. So prostate cancer, I believe, is pretty not aggressive, but it's hard to not, what's the word I'm looking for? You can't find it easily. You don't know you have it until it's already too late. So I think what's the percentage of survival rate? It's a pretty low, I think, once
so if it's diagnosed early on, the survival chance is so high. 98% of cases could be treated easily, but it should get diagnosed early on. That's why it's very important for men to do annual prostate screening.
To be proactive.
To be proactive, yeah.
Right.
So but the main problem is that according to Cleveland Clinic, close to 60% of men, they don't have regular sort of doctor visits. So for prostate cancer screening, after age 50, or if you have some family history, you need to, even early on, maybe at age 45, men should do annual checkups so that if there is any chance of or any issue with prostate, it could be diagnosed early on so that they can take care of it sooner than later. And then with that, there would be no problem.
Right.
The problem is when they don't get diagnosed, when the cancer starts spreading around, and that's when it's problematic. But yeah.
So the issue, I think, is that stigma around it again. Obviously, getting a prostate exam is not enjoyable for many people, maybe some, I don't know. But normalizing that conversation around prostate, around reproductive health, around being proactive about your health and taking care of those things. How do we normalize that conversation with men or with our partners to get people to go get help or get annual testing and make it okay and not make it such a, I don't want to do that?
Yeah. So first of all, when it comes to prostate screening, according to American Cancer Association, there are 2 ways. One is rectal exam and the other one is PSA blood test.
Okay.
So unfortunately, when we are thinking of prostate screening, many times we are thinking of rectal exams.
Rubber gloves.
Yeah, so
Yeah.
we don't feel good. It's definitely it's not comfortable. So at Bastion, what we in our standard of care, which we designed, we send men first to a lab to do PSA testing.
Mm-hmm.
PSA testing, again, according to American Cancer Association, is a good way to identify the initial sort of increase in PSA in blood, which is an indication of enlarged prostate or cancer. So that's how we do it. We basically have the first visit. Our care team talk to the patient, get all the information and the symptoms. Then we send the patient to a lab. So it's more convenient. You do a blood work. It's a simple blood work. You do that, and then based on that, if it's required, we can also do a urine analysis, which is a simple urine sample testing. And then after that, our urologist is going to sit down, see all the lab testings, and see all the symptoms, and make a decision. If in case if there is any suspicion that there is a cancer, prostate cancer, chance of prostate cancer, then we refer the patients to in-person visits so that they can go to a clinic or to a doctor so that they can do rectal exam to confirm it. And then they can go and talk to cancer specialists to help them get the treatment they require. So, but it's very important that they do the testings and initial assessment, and that doesn't need to be rectal exam.
Okay. I think that would help a lot of people to be not as afraid of it. I think that's probably the biggest deterrent. I know that's a lot of reasons. I mean, why women don't get mammograms. It's uncomfortable and they don't want to do it, Yeah. But it is important for preventative care. I mean, preventative care is very, very important. I think a lot of people put it off because I think people think we're invincible until we're not. 2, because it's inconvenient. And 3, because we don't want to think we're not invincible, So if you're making it convenient for people, such as a telehealth platform, it makes it a little bit easier for people to swallow. Okay, yeah, I can do this once a year. So tell us a little bit more about a telehealth platform and what exactly that is. I think that's kind of a fairly newer idea and just gaining more traction in recent years than it had been. So what exactly is that? What does that mean for people?
Yeah. So first of all, we learned a lot from women's health technologies. And as you know, there are a lot of solutions now available for women, a lot of technology solutions, a lot of mobile phone applications. So women could download the app and start talking to gynecologists, start talking to primary care doctors, get all the educational content they need, and order testings that they need, all through the mobile phone application. And that having that access made it easy for women to get the education and support they need. When it comes to men's healthcare, unfortunately, the current men's healthcare is complex, it's fragmented, it's costly, there is a huge lack of access, and there is a stigma. So we wanted to learn from women's health technologies, and in general, men's health technologies are where women's health technology was 15 years ago. So we have a lot to learn from the success stories in women's health. And it's still women's health, there is a huge need still for a lot of other innovation. But men's healthcare could learn a lot from the previous past experiences or previous success in women's healthcare, and design solutions so men could get access to educational content, access to having conversation with doctors, so that in the comfort of their home, they can have the first conversation, learn more about their problem, get the testing that they need to have, maybe get the diagnosis and some level of treatment. Therefore, they can be more engaged in taking care of their health. So therefore, at Bastion, when we are talking about telehealth solution, we are talking about a platform that they download. Then they have a concierge interaction with a care team. They can text the care team, ask questions that they have. They can receive back the answer. They can schedule an appointment with a nurse practitioner or a urologist or a primary care doctor, have the conversation, share their symptoms, get the lab orders that they need, go to the lab, review the result of the lab with a doctor, and basically, first of all, understand better what is their problem. And then when they understand what is the problem, get the educational information about it, and then be more proactive. And again, in the comfort of their home, sitting on their couch, they can have the conversation. We managed to have our appointments in the afternoon and also on the weekends, so that it's more convenient for men, it's more easy. And also we managed to make it more affordable, so that only with very small amount of money compared to paying to a specialist, they can have conversation with urologists and basically start being more proactive in taking care of their health.
So speaking of the nominal amount of that, what exactly would you be looking at if you are looking in? Is it like a concierge where you're paying a monthly fee? Is it something where you pay per service? Is it something where you pay for per lab test? What exactly would somebody expect if they're looking for something like that?
That's a great question. So we have two main health plan that we suggest our users to start with. We have a men's reproductive health assessment and a men's prostate health assessment plan. It costs $225 to start these two plans. And then in that plan, we have the whole concierge experience to do an assessment. We have a care coordinator who's going to follow up, make sure you got the first visit, then make sure that you get the lab orders, go to the lab, and then when you finish the lab, schedule the next visit with the urologist. Make sure you get a comprehensive assessment plan. And then from there, after you get the comprehensive plan, if it's required to start a treatment plan, we have also a treatment plan for reproductive health and for prostate health. So that our users could again, in that concierge environment, have all the interaction they need with their care team in order to get the support they need, get the prescription they need. They can go pick it up from their local pharmacy. We'll give them medication or prescription discounts that they can go and apply to their bills when they are purchasing their prescription, and then eventually at the end of that course of treatment, we can make sure that we can help them. If in case we can't help them, and if the case is so complex, then we are going to help them, refer them out to in-person clinics so that they can get more support from the practices that are going to see them in person and do further assessment and treatments.
And you work with the other clinics that you would be referring them to help them with what you've already done and the course of action that they would need to take from there.
Yeah. So Bastion Health now, it's connected to the healthcare system in US. So we are connected to all the clinics and practices. We are connected to all the pharmacies and labs in US, so that we are fully integrated. Therefore, when at some point, so telehealth is limited. We can help do the assessment. We can help do some treatment, but definitely we can't really solve all the problems.
Right.
So at some point, we might need, with some complex cases, which usually is around 10 to 20% of those cases, to refer the patient out, and we are fully able to do that thing.
So let's talk about some statistics. Let's talk prostate cancer. You said we did say 1 in 8 men, but what are some more statistics about that? About prostate cancer, and how you said 98% survival rate. I mean, if they're getting help and catching it early, or talk about reproductive health, how many men have reproductive issues. Let's touch up on a little bit about that and how we can reach men and know that this is, and normalize it, make it known that it does happen to a lot of men.
Yeah, that's a fantastic question. So let's just start with reproductive health. A very alarming statistic: human sperm count has dropped by half over the past 40 years. So we are half fertile than our fathers. So that means that we need to be more proactive. First of all, something is changing. That's mostly because of lifestyle changes and environmental stressors. So unfortunately, when it comes to fertility complications, the traditional notion is to put the responsibility on women. But that's not true. Actually, a statistic shows that the problem is a 50-50 split between men and women. So it doesn't make sense that women go first. Unfortunately, right now, when it comes to that complication, in the current process, couple after 1 year of trying, women go first to gynecologists. Gynecologists go through invasive testings for women. And if there is no problem with women, then they refer the man to a urologist. So if of all infertility cases, 50% of the time it's because of male factor. So to optimize fertility journey, men and women should get involved in the process to find the quickest path to fertility early on. It doesn't make sense that men don't get involved in the process early on. So that's one message that I have for our audience here. So if we are trying to optimize the path to pregnancy, definitely we need men and women to be involved in the process
together.
So
right.
we want at Bastion, we are changing the outdated view that fertility is a women's issue, and we are building the first at-home comprehensive specialty telehealth so men also can get involved in the process early on in the comfort of their home, start a conversation, try to improve their lifestyle, and also try to see if they need some medical assistance in order to increase their chance.
That's a pretty big decrease in sperm count, and that's due to environmental changes and stressors. That's kind of shocking.
Sure, it is, yeah. And look at that, in the last 2 years, everyone is just sitting at home and behind their computers and working. This is not the this is not the lifestyle that our parents used to have. They were more active. So a lot of changes happened in the last last 50 years, 40 years, that resulted into the current stage of men's health and men's reproductive health.
I wanted to touch on what you said about women going to get help first. One, because you talked about how women have more options and there's a lot more women's health availability. But two, that me being a woman, it is always the woman, and in experiences of all of my friends and people that I know who have had reproductive issues, it is always the woman that goes first. And then it is like pulling teeth to get the man to go to the doctor. No, it's not me. And it's hard because you don't want, a man doesn't want to look like they are not able to provide or they're not able to reproduce. And that's a huge hit to ego, and understandably so. But if you're trying to reproduce a family, then you have to do that process together, because like you said, the longer you wait, let's say you're going and you're getting tested, you're going through this process. Now it's been 6 months, and then now you have to go back and you have to do this again. And now it's been a year, and now you'd already been trying for a year or a year and a half. And then this whole process is going over and over again. So like you said, it's important to start both of you together and see what the problem is. But then you can work on that as a couple and move forward and try to solve the issue of why you're not able to get pregnant. for sure. I think it's very important for people to understand that. And I know, being in a relationship that I'm in, that getting him to go to the doctor is impossible. just to go, just to get a checkup, not even for any other reason, just go to the doctor. It's like, I don't know why that's always been such a difficult thing for men, why men feel that it's weak or not okay to get help. But we definitely have to change that, because I think that that's changed a lot in women over the last 15 years. And we've changed that conversation. We've changed that rhetoric on getting help and being proactive about your health. And we need to work on that with men as well, and being able to have that conversation, being able to talk about those things with your partner, because it's important.
Yeah. So in general, women are chief medical officer of households. They're managing families' health. They make sure their partner is doing their annual checkups. Kids are getting the health support they need. And a lot of time, they know about men's health as much as men know, maybe more. And when it comes to fertility, many times they sort of like try to educate their partners as well. We at Bastion, just to mention, when you ask about the solutions we have, I mentioned about our assessments. We also have preparatory plans. We have a preparatory plan, which is $100. It's a 30-minute consult, purely educational, that we help couples to learn more about men's health and men's reproductive health. We want to help women in order to help them educate their partners, and basically they also know more about men's reproductive health, because anyways it's half of the problem. So both men and women should know about it. And we designed that in order to take care of that educational piece, to make it more easy for men to open up and ask their questions and try to be more proactive. And basically, so they know. When you know, then you can basically be more proactive. The as a healthcare designer or healthcare sort of researcher, we need to design a solution for men. The current solution is not the best solution. So when we are designing a solution, first of all, we need to consider our users. We have men that are different. They are not really taking care of their health. So they are the user that we have. We need to design around them. If we know that men are happy to sit on a couch and watch TV for 3 hours, what if we have a solution so men on that couch, they can start having conversation, if they can, with their care team, if they can send text to their care team, and then get the education they need in the comfort of their home. And at Bastion, this was one of our main goal, to design a solution which is simple and easy and comfortable. So men at the comfort of their home, they can start learning more, engaging more, and have conversation more, so that their partner also can make it. So basically, it just makes it easier for their partner also. So we can take care of all the educational sort of pieces that should be done during the fertility journey.
So what is your goal, other than reaching more men and education? What is your goal with Bastion Health? Where do you see this going for the future of men's health?
Yeah, so we want to focus on different pillars of men's health. We want to design health plans, specific, and sort of design a standard of cares which are simple, so we can handhold our users, walk them through the journey, give them the assessment they need, education they need, and diagnose them, help them with initial steps of treatment, and give them the concierge sort of support they need, so that easily they can walk through this process. Right now, we are focused on men's reproductive health as one pillar, men's prostate health as another pillar. But there are other pillars that we are going to add to our services and design a standard of care, an easy journey, so that it's engaging, and basically, again, design the solution, the healthcare solution around our users so that they can engage in the process. We want to make sure that when they are thinking of prostate screening, they don't think of rectal exam. They should think of a simple blood work. And in order to basically create that experience, we need to sort of make sure that we consider our user and design every single step of the educational piece, assessment piece, and treatment piece, so that they are comfortable to basically work with us during this journey.
And to be able to reach them as well. Yeah.
Exactly.
So, do you think that it will take longer to be able to destigmatize and grow the piece of this puzzle of men's health to the way women's health is now? Do you think it will take a lot longer in that process?
I think a lot of things has been changed so far. With the new generations, definitely they are more proactive. You're seeing a lot of other companies, men's health companies, and sort of like a lot of users now are, or a lot of men are now open to new solutions, because I think the new generation is open to these conversations. But the main thing is that so definitely we need to work on destigmatizing the topic, but also we need to make sure we design something which is easy and simple so the current generation can use it as well.
Yeah.
So right now, what we need to offer, and this is what we are offering, is that, okay, so we had a patient, let me share with you this example. He had enlarged prostate. So he didn't know that he had enlarged prostate. The symptom that he had was he had some problem urinating. And for about 3 weeks, he had that problem. And he was reaching out to urologists. The earliest that he could schedule was in 2 months. He was frustrated. He found Bastion. He reached out, got his health plan, and in the comfort of his home, he's a semi-professional golfer, so he wanted to talk to our doctors in the late afternoon. So he was talking to our care team in the afternoons, and he got his first visit, his assessment, second visit. He was diagnosed with enlarged prostate, and all in the comfort of their home. And he was in his 50s, so in the comfort of his home, he got all the support that he was needed, and then he was engaged in the whole process. He was sending text messages, getting the answers to the questions that he had, just because it was accessible, it was available for him, and he experienced that how easy it would be compared to other solutions that he had. So back to your question, the stigmatizing is one thing that we need to do. Making the whole process simpler is the other piece that we need to do, so that it's really solving some problem.
Yeah, I think that's definitely the way things are going. People want to make things simpler and quicker. Apps, texting, it makes it a lot easier than calling and waiting on hold and scheduling an appointment 2 months out. And it can be very, very frustrating as well. You know, you're trying to get in, you're trying to make a doctor's appointment, and then they're so booked out that you can't get in. And at that point, you're just frustrated and don't even want to do it anymore. So if you can make that appointment to go to the urologist, but in the process, now you have an option to do the blood tests and do all the work ahead of time, then you're prepared when you go into the doctor already. Yeah.
Exactly.
Is there anything else you want to leave our listeners with today?
So I think one very important thing when it comes to men's health is that we need to basically be more proactive. And for your listeners, for male listeners, they need to be more proactive. In order to be more proactive, definitely they need solutions. We suggest them to jump on our website. It's www.getbastion.com. Learn more, get some educational contents that they need, and engage with the materials that you have there. But also for their partners, I think it's very important that they help, as chief medical officers of households, help men to basically be more proactive. If your listeners are listening now to this podcast, I guess it would be good for them also to a little bit learn about our solution, suggest our solution. It could be a good gift for Valentine, or it could be a good gift for for New Year, so that we offer more healthcare solutions to men, so that they can be more healthier.
And just to start that conversation.
Exactly. Yep.
Yeah. And Bastion is spelled Bastion, and the website is www.getbastion.com. And I will also have that in my show notes as well. Reza, thank you so much for coming on the show. I really do appreciate it. I think we learned some really fascinating statistics that I think people didn't know. The number of men that do get prostate cancer, and also that half of reproductive issues are men and half are women. I think it's important to understand that it's definitely not one-sided, and that we need to have that conversation with our partners. So thank you so much for coming on the show. I really do appreciate it.
Thank you so much, Gabby, for having me.
Yeah. Thank you everyone for listening, and we will see you all next week.
Thank you so much for listening to the Fit Minute Podcast, Fitness for Real People, with your host, Gabrielle Mazar. If you would like more information on today's episode, you can find it in the show notes and on Gabrielle's website at www.destinationfitcations.com. Visit to keep an eye out for upcoming fitcations. Be sure to share the show, give this podcast a review, and subscribe so you won't miss an episode. Join us next week to hear more stories from people just like you. This has been the Fit Minute Podcast, Fitness for Real People, with Gabrielle Mazar.